about the cardiac defects, like what is meant by heart attack and what is meant by heart block, whether this heart attack and heart block, whether these two are same or two are different. So we are just going to review about this. So first of all, what is meant by heart attack? So what are the symptoms of the heart attack? What are the signs of the heart attack? So first of all, symptoms like mainly the first thing is chest pain. Yes, that is chest pain. But in between, by patient to patient, the symptoms also can vary. Okay, so mainly if a pain is related to cardiac, we want to rule out whether that pain is limiting us or not, whether it is non-limiting. So if we are having the pain at all the time, and if the pain is increasing when we are doing any kind of heavy works like lifting a weight and walking up in the stairs, anything heavily, that pain is exaggerating. So that means it's a typical features of a cardiac arrest. So another main thing is not all pain will be like cardiac pain. So lot of things are there to differentiate. So whether this pain is mostly towards the left side or a central pain, whether this pain is radiating to our shoulder, then to our arm, then mostly this pain will be related to cardiac side. And some patients will get the same pain like epigastric pain. Some will have a chest discomfort, some will have a chest heaviness, and some will have a epigastric pain also, can be a cardiac. So this not only based upon the pain area. So when we are arriving in a hospital by complaining of chest pain, the doctor or a nurse will advise us to do a lot of blood tests, which is including troponin. Then they will ask us to take this basic ECG. So with the ECG report only, mainly this heart attack is interpreting. So in ECG, what we can see, they will call it as STEMI or NSTEMI, ST elevation myocardial infarction or non-ST elevation myocardial infarction. That means this in the normal ECG. I'll just give a picture here. There will be lot of waveforms, a kind of lot of waveforms. In that, doctors will mainly rule out whether there is a chance of cardiac arrest is there, or any cardiac arrest has happened in between this last past hours. Mainly ruling out a cardiac arrest. Then after that, the doctor or the technologist will check whether the heart pumping or the ejection fraction. It is also called the pumping level or the ejection fraction. How much pump is, what is the percentage of blood which is ejecting from the heart, whether it is normal or not, or whether the due to this cardiac arrest any pumping related issue was happened or not in the heart. Also we can check in the echocardiogram for the test. Then the patient will be proceeding to the angiogram or angioplasty or the coronary artery bypass grafting based upon the angiogram result. This is the main thing, all the thing which is happening. Okay, so in ECG the doctor will check there is a any chance of getting the cardiac arrest is there or not. Okay, so the medical students or the medical students who are, or the medical staff who are watching this video, they can understand. Mainly in ECG they will see any ST elevation is there or ST depression is there, and they will check our cardiac biomarkers and some blood tests. So from the blood tests, like how they can identify a cardiac arrest, how they can identify a cardiac arrest from the blood test. That means there will be some certain enzymes which is releasing from our heart to the bloodstream during the time of cardiac arrest. That level will be it will be reflected in the troponin T and troponin I. These are the cardiac enzymes. So if we had a cardiac arrest in the few time, like one day before or between these hours, this troponin, this cardiac enzymes will be elevated. If the enzymes is elevated, means there is a cardiac arrest already happened, or now the patient had a cardiac arrest. Okay, so that is mainly depicting here. Then one misconception, I'll just correct it. So some it is a common thing. So whether this heart block or a heart attack, whether it is same, heart block is an completely a different entity, completely a different topic, and rather than the heart attack. Heart attack is known as myocardial infarction, MI, or a cardiac arrest. Okay, heart blockages mean it will this defect, not the defect, this issue will happen at the level of our electrical system of the heart. Not all this cardiac arrest and all is the cardiac disease. There are a lot of different kind of cardiac diseases are there. This include muscle disorders are there, problems of the valves, because we have four chambers in our heart. In between the chambers there are like, so we have four chambers in our heart. So these chambers, in between the chambers there are a small doors which called valves. This it will prevent the leakage of the blood from one chamber to another chamber. Sometimes some patient having problems with the valves, some patient will have any defect or a hole in between the chambers, in between the upper chamber or in between the lower chamber, and in between the blood vessel sometimes there is a chance of occurring a hole. Sometimes the clot will be formed in the heart. Sometimes there will be like bacterial or viral any infections will be the happens, that growth will be also can seen. Some will have some tumors in the heart. So there are different kind of cardiac diseases are there. So that is the first thing. I told you like how this heart attack is diagnosing. So we want to know like how this heart attack is happening. So what are the features of like what are the existing comorbidities which we lead into cardiac arrest. So that are the things we are covering in this portion. So if we have any hypertension or diabetes, there is a chance of getting a cardiac arrest, but these are like predisposing factors. If these factors are there, like there is a risk, we can tell. And it is not like if you have a hypertension, you have a diabetes, so definitely you have a cardiac arrest, you are getting a chance of cardiac arrest. We cannot able to tell that. So these factors, there are different factors also doctors will rule out for the suspicion of the cardiac arrest. And the main thing of getting blockages in your arteries of the heart or the blood vessel of the heart is main thing is cholesterol, high level of low density lipoprotein or LDL, and low level of HDL, high density lipoprotein. So if the cholesterol level is very high means, so we have the blood vessels, right? So inside the blood vessel, this clot, sorry, not the clot, this cholesterol will gradually will be stored in the walls of the blood vessels. If our cholesterol, like if you are taking a lot of oily foods, fried foods and all, means gradually it will take around lot of years, and it won't be like sudden cholesterol deposition won't be there. It will take a lot of time, and it will form a layer inside your blood vessel. Gradually what happens, there is no any space to pass the blood, and it will block our blood vessel. So what happened, so heart is pumping, so blood vessel is supplying, giving the blood to the heart also. Okay, there are some blood vessel which is covering the heart, okay, which are helping to give oxygenated blood to the heart. So the heart is pumping the blood towards the other, like heart is pumping the blood to other organs, right? So heart need blood, right? The heart should be very healthy for the pumping. So from where the heart is getting the blood, from some blood vessel which is covering the heart, known as coronary arteries. So in this coronary arteries, if the cholesterol is getting deposited, means if any small branch or any big branch, if it is getting blocked, means so to a particular portion the blood won't be getting supplied. So what happen, that there will be like muscle or cell tissue will be there, so the tissue is not getting oxygen. So what happen, there will be insufficient blood supply, so it lead into like cell death will happen. So a small portion of our heart is not getting enough oxygen. So what happened? Same like a wound, a cut happens in my hand. So first it will be like fresh. Then after that, this tissue will be like gone. Cell death will be happen. So, and to that particular area, cell death will happens, and it will lead to, at that time we'll get a chest pain. Okay, so the process is like that. So try to avoid like oil contents. Okay, eat healthy, add a lot of vegetables, fruits in your diet. Okay, so don't depend upon the fast food at all. The main thing is avoid like smoking completely. The smoking is a very bad thing to our heart. Okay, it will cause blood clot also to be formed inside this blood vessel instead of the cholesterol. That is very dangerous. Okay, and if the doctor is confirming a cardiac arrest for one patient, and if the doctor is telling like emergency angiogram is needed, and we have to rule out at where this blockage happened, and we want to remove this blockage, the doctor is advising to do a coronary angiogram. Means do the angiogram as soon as possible. Okay, don't delay it. So however the time we are delaying, till that time our heart pumping is will be also getting worsen. So that is the second thing. Okay, so this cardiac arrest will be lead to um, death only. So it is very dangerous. So if the doctor is advising, means we are not supposed to delay it. Then what is meant by angiogram? Angiogram means it is not like a surgery and all. It's like an invasive procedure. Okay, so it's a non-invasive procedure. So that means so we have a lot of blood vessels, right? So through our blood vessel, the doctor will insert a small plastic kind of small tube which is called catheters. They will insert it. So this will be directed to our heart through our veins or the arteries. Through the arteries it will enter into our heart, not through the veins, sorry, not, through the arteries it will enter to our heart. One big vessel, to one big blood vessel it will be directed. Then doctor will inject a dye. Okay, so this will show the blood vessel which is supplying to the heart, and doctor can see through the x-ray images, not the normal x-ray, through the coronary angiogram. They will see like at what level this blockages happen, whether this blockages. So we have mainly two coronary arteries, or the two main blood vessel which is supplying to the heart, in which the second blood vessel is dividing into two small further blood vessels. So one big blood vessel, this is called RCA, and another one is called LCA, which is dividing into LAD and LCX. So these are the three blood vessels. Okay, so the doctor is checking, and if the doctor is checking, and if there is a complete like if there is no any blood supplies occurring, and if these three blood vessels are completely occluding, means in that case, depending upon the risk factors, doctor will tell you like this angioplasty cannot be performed, and the patient should undergo a open heart surgery. So CABG, coronary artery bypass grafting. So before that I'll tell you what is meant by angioplasty. Angioplasty means, so this blood vessel is there, so there is cholesterol deposition or blood clot which is informed. If the blood clot is there inside, means the doctor try to remove the blood clot, and after that, see after a long time of cholesterol deposition, including the calcium, if lot of years, means the calcium will be also like be occluded the vessel from our heart bloodstream. So this it will form a plaque, same like a calcium plaque. So the doctor will try to insert a balloon, small plastic kind of balloon, and it will inflate and deflate this cholesterol or the calcium. They will try to resolve, and they will try to remove it. Then they will keep a small steel or a spring kind of thing which is called stent, and so further if any cholesterol deposition is there also, this won't be closed, it will be open, and the blood supply will be keep on getting to our heart. So that is known as angioplasty. But if in case if there is a complete blockages, and if doing angioplasty, it is very difficult, means in that case only the doctor will advise or refer to a cardiothoracic surgeon, which will open our chest and will perform a CABG operation. Okay, so this is the main difference. If in case if the angioplasty is not performance, CABG. So like some patients won't get benefits from the angioplasty, and some patient will get benefit from the CABG. For the CABG means the patient need the time to recover, so this scar should be like it should be gone after 3 to 4 months. So if the patient having diabetes means it will take time to heal the scar. Okay, and if it is angioplasty means only small one prick or one prick in your either in your thighs or through your arm will be like they will incise. Okay, so it is not like any open thing. So angioplasty is nothing to be worried of. They will give you a local anesthesia, under x-ray guidance only they will do the procedure. The procedure is like that. Okay, so if the doctor is advising, do not delay it, try to do it as emergency. Okay, so these are the things mainly I'm covering. So in the next video I'll just cover, or I'll just explain you what will be the like holes in the heart and what is the muscular disorder and all. Okay, thank you.